I was gonna do my video on vital energy cultivation, and I will, on the Western magical traditions in vital energy cultivation, and I do plan to do that, particularly with some of the work of Israel Regardie and some of the other, late 19th century and early 20th century magicians like Aleister Crowley and their roles in these things like the circulation of the body of light ritual and things of that nature. But what I wanted to go into, I just realized I do not do enough videos on orthomolecular medicine or orthomolecular psychiatry. So before I start talking about orthomolecular psychiatry or orthomolecular medicine, I want to make sure that people understand I'm not a doctor, I'm not a nurse practitioner, I'm not a registered nurse, I'm not a dietitian, I'm nothing like that. So before I get started, I want people to know I am not a medical professional. I am not currently a mental health professional, and this video is for entertainment purposes only. But I want to start off by saying with mental health issues, there's two primary causes, and then there is a gray area between the two. So the two primary causes of mental health concerns are existential crises, meaning that there are things happening in the environment such as poverty and such as, abuse, things of this nature that become an existential crisis, lack of belongingness, things of this nature, which lead to an existential crisis, which leads to mental health and behavioral health issues. The other is the biological origin of mental health issues. And we found, not we, I'm not a researcher, but there has been found a lot of interplay between genomics and epigenomics in the cause of these health concerns. Being that I'm reading Dr. Morgan Levine's book, True Age, it's made me want to make a video on epigenetics and the role that plays in mental health and mental, cognitive decline, schizophrenia, bipolar disorder. These things can be affected greatly by nutritional factors, by a lack of exercise, and they can also be affected by correcting nutritional factors and correcting exercise habits and correcting health behaviors. Or health habits, I should say. But the thing is, these things are generally overlooked by the mental health community because the mental health community does not look at mental health as a medical issue anymore. Although they do throw medicine at mental health issues, they are not looking at it as something that can be corrected, like heart disease or diabetes or something like this, when that's exactly what they should be doing. Now, what's funny is when I worked in mental health, it's very popular for therapists to try and inform their patients that, a mental health issue is just like diabetes. If you don't take your medicine, you'll die or you'll end up in the hospital. This is not necessarily true. Now, remind you, I'm not a doctor, I'm not a mental health professional, so this is for entertainment purposes only. But it's not necessarily true that if a person with bipolar disorder stops their medication, they're going to end up in the hospital. However, if a diabetic stops their medication, it's a sure thing they're going to either end up in the hospital or die. Okay, that's almost a sure thing. If a type 1 diabetic is to stop their medication, they're done. Okay, that's a positive thing. My mother was a type 1 diabetic. She got it because she got an infection in childhood that destroyed her pancreas. So I know all about type 1 diabetes, and that's why I never quite caught on to the idea that if I don't take my medication, I'm going to end up in the hospital like my mom, because that's not the case, okay? So one of the factors that's been found to relate particularly to schizophrenia and autism, and the reason I'm doing this video is that case with that Lacey Fletcher, that really rubbed me the wrong way. It really upset me. Watching those videos and learning about that. And it's very sad that a lot of people with autism and a lot of people with schizophrenia, autism and schizophrenia share many of the same characteristics. In fact, when autism was first recognized, they thought it was a form of schizophrenia, and now they're starting to rethink that and think maybe that, schizophrenia and autism are co-occurring issues. Autism is a symptom of schizophrenia, which means to turn in on oneself. And it's very sad. I worked with a lot of highly, highly, highly psychotic people when I worked in mental health that had schizoaffective disorder and schizophrenia, and even bipolar disorder with psychotic features. So I understand what it's like to work with people with psychosis. I've also worked with a lot of drug addicts. I've dealt with a lot of drug-induced psychosis. And it's very sad that these people go through life, and a lot of people don't understand that these conditions can be caused by many factors. One of those factors is genomic instability. Okay? And genomic instability is, of course, an instability of the genome, and this can be corrected by nutritional therapies, okay, by nutritional interventions. There are a number of nutrients. Of course, the B vitamins, as I've talked about in the past, help to correct genomic instability. Vitamin C helps prevent and correct genomic instability. A number of the fatty acids help in this respect. And this is overlooked. This has been overlooked too much by too many different people. And it's time that, more people look into like Dr. Abraham Hoffer's ideas. Niacin, which is one of the most popular orthomolecular treatments for schizophrenia, helps to correct genomic instability. And the people are starting to rethink their RDAs for, which is the recommended daily allowances, simply because there might need to be more of these specific vitamins and minerals to protect against genomic instability. And this was first popularized by orthomolecular psychiatry and orthomolecular medicine by Dr. Abraham Hoffer and Dr. Linus Pauling way back when. And it was also popularized by Dr. Joel Wallach. Dr. Joel Wallach, who was a veterinarian and is also a naturopathic doctor, was one of the co-founders of the theory of, the discipline of epigenetics. And it's very interesting. Reading Dr. Levine's book has caused me to really want to make more videos of this kind. And it's really something that needs to be understood. Now, with orthomolecular medicine does not discount the need for allopathic medicine or, it doesn't discount the need in some cases for pharmaceuticals, but it also doesn't discount the need for nutritional interventions and lifestyle interventions. And this is the biggest problem I think you have with behavioral health, is they are not looking at enough of the lifestyle interventions. Another thing is what I wanted to get into in this video, and I will get into right now, because I warned people about this back in the day. In Alaska, they're trying to take away people's right to informed consent. And when I worked in mental health, I would go to the county meetings and I'd go to state meetings. And this is something that was brought up again and again and again. They always wanted people, they pushed people questioning their sexuality. They pushed transgenderism. They pushed LGBTQI acceptance. They didn't want people's clients, questioning these things. And these things, and I pointed this out, where do we draw the line with this? Are we going to start putting people in prison? Are we going to, see, the thing is with this, Ronald Reagan did not close down the institutions, as everybody says. What he did is he made it more difficult to disappear people into institutions. Because what happened is mental health asylums became a very convenient way to make people disappear. Okay? If they had inconvenient political views, if they had inconvenient societal behaviors, if the way that they behaved was inconvenient, they could be disappeared. And when Reagan passed certain laws that made it so you couldn't do that anymore, there have been a lot of people trying to reverse those laws and make it easier to take away people's rights, to make them disappear, and to force them to take powerful pharmaceuticals against their will, to harm them. And that's the thing, is I'm a big believer that if somebody is a harm to themselves or others, the state has the authority to take them, to observe them for 72 hours or more, and to make sure that they're not going to hurt themselves or others. I am a big believer also in the fact that nobody should have the right to inject or force anybody to take any pharmaceutical products against their will. I think that this is absolutely insane, and this borders on totalitarianism. It is totalitarianism, and it's a loss of bodily autonomy by the individual, and a loss. And when you lose your bodily autonomy, you lose freedom. Without autonomy of the body, you don't have any other rights, because that's your right to be who you are, to be unencumbered by powerful medications or drugs should be an inalienable right, because without your right to be you, how do you really have any other rights? It's kind of like without your right to life, how do you have any other rights? You don't have any other rights. And that's the thing, is it's very hard to have any rights if you're not alive, and it's very hard to have any rights if you're no longer yourself, if you're being turned into a zombie by forcible medication. And it's kind of interesting, because zombification, like Haitian zombification, uses neurotoxin, okay? It uses a neurotoxin that turns the person into a zombie. And a lot of these psychiatric medications are just that, they're neurotoxins. And that's what I think is something that needs to be stressed, that a lot of these state governments are now, like Alaska and other places, they're trying to impede people's rights to autonomy and their rights to not be medicated. And they're trying to use certain current events to try and force this on people. And I don't think that this is a good idea. I think it's a horrible idea. And I think it's going to really damage the freedom of the American people. But I also don't think it's going to take hold, because we've seen things like this before in the past with NAMI, the National Association of Mental Illness, and that teen screen debacle that got caught, thank God, before it started being implemented in schools. But I mean, you have to understand that these things are very dangerous to the public health. It's not just the autonomy of your body. These drugs have powerful side effects. Powerful drugs have powerful side effects and powerful health implications that can damage your body powerfully. And that's why I do think that lifestyle changes and changes in health habits and things like this need to be integrated into psychiatry, need to be integrated into the mental health field, and you need a more holistic approach. But this is not an attack at the medical model. The medical model I find is sound. It's just the only thing I disagree with is that these pharmaceuticals I do not believe are delivering the promises that they claim to be delivering. A schizophrenic on antipsychotic medication is, generally speaking, as schizophrenic as a psychotic off of antipsychotic medication. And that's just how it is. They might be more manageable, they might be more sedated, they might be drooling on themselves in a corner, they might be 150 pounds overweight or more, but generally speaking, they're just as psychotic as a psychotic that's not on the antipsychotic medication. So my point is that I do believe that there needs to be more, another look at this integration of nutritional therapies, and I think we're getting there. I think we're getting there with the help of people like Dr. Morgan Levine and the help of these people that are actually studying gerontology. I think we're starting to see the interconnectedness between premature aging, genomic instability, these things, and also what could be termed early dementia. Schizophrenia used to be thought of as early dementia, and I think that's probably quite accurate. I think that you're seeing that the more we learn about science, the problem is the disciplines are they're scattered across different disciplines where they shouldn't be. I think mental health is just as much a real issue. Of course, it's an existential issue. There's existential issues, social issues, but this is true with aging in general. And that's all for this video. I want people to follow the links in the description. There are going to be plenty of links in the description, and please do follow the links in the description.